Okay, now we're going to be welcoming back our lovely Robbie Singh, who also happens to be a program supervisor at Autism Partnership's Melbourne office. Robbie has a bachelor's degree in applied science, psychology, and a graduate diploma in psychology. Robbie's worked with children and families in a variety of settings, including centre-based, home-based and educational settings. And he's going to discuss autism and early indicators. Please welcome back Robbie.
Hey, so I'm just going to hug the stage today, pretty much. I'm just doing every presentation for you guys and just going to hang around because you guys are really fun. I just got to say, guys, like straight off the bat, a lot of people are very reserved in these kind of settings, and you guys really participated, and giggling and laughing is fantastic. It just makes it easier to present. So thank you for being a great group of people to present to today. So I'm guessing all of you guys work with kids, because unless you're like nannying adults, because who knows nowadays with our extended adolescence that we're going through, how many of us are going to need that in a couple of years. But you guys are all working with kids. Can I just get a show of hands? How many are working with infants? So a huge range of working with infants. How many are working like still when kids are school aged? How many are working with multiple kids? Okay, cool. So we're kind of covering everything here. Now, how many of you are working with children who have an ASD diagnosis or an autism spectrum diagnosis already? The room cuts, right? It gets lower here. Now, how many of those families that you work with, the ones who said they do have an ASD diagnosis, are a single child family? None. How many is the eldest child? Yes. Yeah. Can one of you guys say around what age was that child diagnosed? About 3, right? So most common age for children to receive an ASD diagnosis is around that 3-year-old mark. The later then usually becomes around grade 3. Few children get diagnosed before 2.5 years of age due to pediatricians being a little bit conservative about it, but we can diagnose children as early as 10 months old with an ASD diagnosis, because there are some clear indicators that allow us to know that there are symptoms that we need to be aware of. And that's what I'm talking about to you today, because generally what happens is children or families don't find out about the indicators until they get into childcare or the school setting, or that because most children that get diagnosed are firstborn children that it comes through. So families just aren't aware because it's their first experience raising a child. So it's really, really important that us as people working in the community with children, myself as a martial arts instructor, seeing children that I need to talk to parents about things going through, when they come to me through AP, they've already got a diagnosis or we're in the diagnosis process, so I can't really go through. But when I get called in to do initial observations, it's because somebody has highlighted to the parents something's not quite right usually. And I'd say that, I'm making up a statistic here, but over 50% of the time, is what would be from somebody else. Very rarely do the family just jump in and go, hey, I think there's something wrong here, because they're incompetently ignorant. They don't know what they don't know at that point in time. So, slide. So just to give you a little bit of background, don't worry about this one. You guys know who I am now. So who I work for is Autism Partnership. Now, Autism Partnership is a organization that started in LA by two gentlemen, John McCacken and Ron Leaf. Now, we practice applied behavioral analysis therapy, or ABA therapy. Some of you people may have experience with, or some may not have experience with. But the key thing to know is that so far it's the only evidence-based practice for children with autism. It's the only intervention that is covered so far by insurance companies in America, and with the NDIS coming into Australia, it's through a multidisciplinary team. It will be speech, OT, and ABA therapy will be the evidence-based therapies that are covered through the insurance schemes, and that's purely because there's science backing it up. More science than's been put into other interventions so far. We have offices in 8 different countries around the world: Singapore, Hong Kong, Australia, New Zealand, UK, and America. And what we really do is we work with children in a variety of settings. So whether it's in the school, whether it's in the workplace for older adults, whether it's in the home, or whether it's in childcare centres, we kind of go across everything. Thank you. So we present psychological consultation, we do assessments of children, and then we have program supervision, which is kind of my role. So I work with families and their teams to implement therapy, and whether it's motor skills, whether it's language skills, whether it's social skills, whether it's daily living skills, whether it's whatever it is that the deficit is there, we kind of cover that within our program, because autism is a diagnosis that it covers a person's entire life. It's not like diabetes where you just have issues with your sugar levels, or it's not like eyesight issues where it's just my eyes and I can put a pair of glasses on. So I need a holistic approach that covers a holistic person, because we're not just little bits and pieces. We're a sum of all those pieces. So in the new DSM, which is the Diagnostics Manual for Psychological Disorders, they changed the diagnostic criteria for autism. So it used to be a range of different diagnoses, including pervasive developmental disorder not otherwise specified, which is like, I can't quite give you a diagnosis, but we know you're in the ballpark, so we're going to give you this. And then you had your Asperger's and you had your autism, which colloquially referred to as high-functioning autism and low-functioning autism. Now it is just a single diagnosis of autism spectrum disorder, and we see that there's two main areas that kind of affected: communication skills and ritualistic behaviors. And there are two things we look at: behavior and communication. Now, communication covers social skills, it covers your language skills, it covers your non-verbal language skills, and behavior includes acting out behaviors, your rituals, your rigid behaviors, your inflexibility, your cognitive behaviors about the way you think about things, the schemas you build within your mind. So they've covered quite a lot into two little areas. So with all of that, then you're working with a kid and you've got to look at all that. How do you actually know, is there something going on up? And there's some key indicators for it. So the first area we'll look at is communication. Skip over this one. Okay, so the warning signs for communication are children who are verbal, very important. So verbal communication can come through in a few different ways depending on their level of functioning. So there are children who are really, really verbal. There are people like, you commonly hear of things like Albert Einstein had Asperger's, or this very, very verbal, but there are things that are going on with their speech that are indicators. So one is an abnormal tone of voice. Whether it's imitation of accent, so very commonly you'll hear kind of the stereotype of the child with Asperger's who has the British accent. And it's usually because they've been so engrossed in Thomas that's what they've learned to speak, and that's the scripts that they've been using, and an accent comes through. So abnormal tones of voice. They use repeated phrases, which we refer to as scripting, where they've heard something from a TV show and they repeat it over and over again. And some kids use that as a self-stimulatory behavior. Some use it as a functional communication because it's all that they've learnt at the moment as little contextual statements that work for them to get by. Some people are nodding their head like, yeah, I've seen that before. So it's nice that you guys are seeing this in your view because you know what you're looking for when it comes up. So high functioning, lots of language going on. Then you have lower, the scripts coming through. And then you have things like children who are developing language and you kind of hear odd babble or only the same babble, so really repetitive of the same babble over and over again, or sounds that are nonsensical. So they're trying to say words, but the words never quite get there. So some indicators there. Then there's non-verbal indicators for communication. So we'll just... Thank you. So there's two kind of forms of nonverbal communication. There's my nonverbal communication to you. Mike's back. And your nonverbal communication to me. So there are some children who can articulate quite well, but they don't use any gestures themselves. Gestures, whether it's in their face with affect, whether it's with their body language and their ability to move and face you and direct myself to make sure I'm talking to everybody, is a core one. The other is receiving cues, like the lady falling asleep in at the back over there. She's telling me she's bored. I'm joking, there's nobody there. Right? Or the read that, you know, like I'm trying to talk to you and you're kind of like shifting your body away, says you're uncomfortable. A lot of our kids miss those nonverbal cues because they just haven't been given the skills to navigate the social world yet. So we've got language skills, verbal and non-verbal, to look for. And then we have next, let's get you to change here. Next, we have social signs. So some of the things that can come up in play. Play is a great indicator to say, hey, something's not quite right now. Because you can see a lot in play. You see the language coming through, and you see the social skills coming through, and you start seeing behaviors come through. And some of the social behaviors to look for are very simple: a lack of social awareness, a lack of mindfulness about the social interaction. So I'm playing trains, and we've got a little story going on, and the guy's got Cranky's back, the crane from Thomas, and he's not helping with the wrists anymore. He's now just playing a game with trains, and we're playing, and my friend over here, he's kind of sitting there, and he's just building the track. And 3 other friends are over there, and they've got Cranky, and Thomas is coming, and he's got a load, and Cranky's helping move it. My friend who's over there still just building a track. And the guys shout out, hey, can you pass this over, Percy? And he's still building a track. He hasn't picked up that, hey, people are trying to join you into this play. He's more fixated on, I'm building a track over here, guys. Like, can't you see that? I'm really invested in this right now. And not realizing, like, hey, it's more fun when you have more people involved. So that lack of social awareness. Also, just a lack of people. Sometimes you'll see our kids be very mindful, have a lack of mindfulness around, there's a group of kids playing here, but I want to go over there, and they just walk right through the middle of the play. So that lack of social awareness is a huge one that kind of comes through. The other thing is inappropriately breaking personal space. So like talking to somebody and just kind of like resting your hand on them and not realizing that that's uncomfortable for that person there. The other one is just getting too close, like right up in your face as you're talking to the person. Or cuddling people with inappropriate social relationships. So like if you're kind of take them out and you're going for like a venture into the community, and they want to shop, like hug a shop assistant, or they want to like blow kisses to people as they walk by, or they're just saying hi to everybody that they walk by, not realizing that at some point that becomes unusual to do that, is an indicator that some things could be awry. Now, one indicator isn't enough. Multiple of these coming up has to be something we have to be aware of. So I'll just get you to flip to the next one. The next is behavioral science. So I categorize behavior into 2 separate ones. Self-stimulatory behavior, because it's a very separate one. And then there's just behavioral issues in general. So issues around following routine. I must come home from school, my shoes must go on the rack, the bag must go on the hook, and my bag must go on the thing before I can go and play. And one day the coat rack's full, and there's nowhere to put my coat. So you go, hey, don't worry, just put it on top of your bag. No. What? Oh, come on. We're getting a 5-minute warning. I can go for ages. They go, no, can't put it on top of the bag. Not doing it. And you go, it's okay. Don't worry about it. Yeah, it's just something so simple as that. And like, no, the routine is shoes go on the rack, bag goes there, jacket goes on top. That can't be changed. And so a lot of times we just accommodate. We go, okay, cool, I'll take your jacket off and go. But it's a sign. It's a sign, hey, something's not quite right. Or you're walking home from the playground, and every time you go down the park, and you take a right around the park, and you walk the right way around, and you go through, and one day you go, hey, no, we're going left today. And they're like, no. And they put the brakes on, and a little bit of a tantrum comes up, and you go, okay, that's an indicator that something's going on there, that they've got rituals around certain ways that you have to go through. They go to kinder, and the first thing they do is they go to the bike. And they kind of go there, and they hop on it, and they hop off, and then they go and find something else to do. It's not that they want to play with the bike, but the routine is I get to kinder, I go to the bike, and I go somewhere else from there. So little indicators that kind of come up for you that go, hey, let's be aware something might be going on here. The next part that kind of comes up is self-stimulatory behavior. So I'll just get you to move to the next slide. Now, self-stimulatory behavior is behaviors that children engage in that have no functionality to them. And this is the key, there's no function to them, but they receive pleasurable experience engaging in and stop them from enacting with their day-to-day living skills. Hand flapping is a very common one that comes up. There's jumping up and down. Toe walking is one that you'll kind of hear of very commonly. Yeah.
Sorry, can we just talk about age groups with these kind of cues? Because
next slide. I'm ready. No problem. So yeah, spinning objects, staring at the wheels are all things that come up. So on your point, if we go to the next slide, what age group do these kind of come up, and what are the key indicators to look for? So at 6 months of age, we can start going, something's not kind of on, if you're missing that cooing, that smiling coming through when you smile at them, because what it's telling us is that they're not recognizing that there's a person in front of them engaging in a social experience with them. So something to look for very early, an absence of eye contact at that 6-year-old mark. The smiles aren't there when you're laughing at them. They're not cooing when you're kind of cooing. There's not that reciprocal babble that kind of goes on. I've got a daughter right now who's 6 months old, and I work with her because I'm an interventionist, so that's what we do. We just work with our kids because they're the experiment, you know. But I'll do things like, you know, like I'll go up and I'll peek my head over the bassinet, and she looks up because she's like, person, and I go back. And then I go to work and I'll work with my 2.5-year-old child with severe autism, and I'll kind of be playing there, and I'll be in the puppet set, and I'll put my head up from behind the puppet thing, and they don't look. They're still engaged in what they're doing, or they're hand flapping at that time, and there's a lack of that contact. So at 6 months old, we can already start seeing that come through. At 9 months old, there could be an absence of the development of language. So you're missing some of that babble coming through. A really key indicator of language development. Babble, they're trying to communicate. It doesn't have to be sensical, but it has to be reciprocal. I make noise, you make noise. Hey, we're in a conversation. It just, to that kid, they're saying whatever they want. To me, I'm saying whatever I want, but there's something happening. If that's absent, it's an indicator at 9 months. At 12 months old, a kid should be responding to their name. No. All right, so... Go.
I work with an autistic boy who's 6 years old.
Yep.
And I don't know everything, but like the mum mentioned to me a while ago, a couple of years ago, that he couldn't actually formally be diagnosed until he was 5. Because
Yeah.
until 5, they just do an official diagnosis until... Is that right? Or...
The thing with autism is it's such a personalized disorder. It's so individualized, and it's one that creates a lot of emotion behind it. So a lot of people are reluctant to do diagnosis early. And if there's I'm talking about medical professionals, because they're worried about putting a label on a child.
Because it could just be like the child, you know, just growing up, you know.
It could be. And it could be something where they just haven't been exposed to an environment that allows the skill set. But this is like me saying to you, I kind of know you have diabetes, but I'm not quite sure I want to label you as a diabetic, so we're not going to give you insulin yet. Yeah. So we're just going to let it go for a while, and we'll just see if you grow out of your diabetes. So what happens? More and more problems develop over time. So then you have to do more intervention later on in life than hitting it early. And so that's why we're more conservative in that we'll put a diagnosis early, do the work, and then you can lose your diagnosis. Yeah, right. We can reassess you, and you might not have a diagnosis. I've got kids that I work with who I wouldn't even diagnose, but they have enough areas of issue that we're still going to do the exact same intervention because it's just a good personal development. Right? So it will happen. Some professionals will say no, but I'm more inclined to be like, hey, the label doesn't matter because I don't have to tell everybody, but it does help create direction of intervention. And that's what I'm always looking for, is creating a direction for the family to go with. So coming back to the 12-month-old mark, so not responding to their name, huge indicator. Next one, lack of reciprocation. I tickle you, you want to tickle me. I tickle you, no response. Okay, there's an indicator as that something's not right. Now, they might not just like tickles that day, but if you're getting a lack of response all the time, something's not there. So we need to look for that as well. At the 16-month mark, if you've had no spoken words, absolute lack of that. Now, they might be babble, but there might not be any words by 16 months, indicator, right? Something we need to work on there. And then by 24 months of age, if you have no 2-word phrases developed and you have no language based around desire, we have to put something in place. So we have to start investigating. And that's it. We're not saying there's a diagnosis. We're not saying that there's anything you need to do to start creating change. But what you do have to do is start investigating, because awareness allows us to know if there's something actually going on. So let's be aware. Now let's do something with it. So what do you do? And in your role is a very interesting role, because you guys all blur a lot of boundaries straight away being nannies, because you're in the home. So like, you get invested with the families, you're invested with the kids, and you're also in a professional relationship as well. So what do we do? The first thing, if I can just flip this way. The first thing we need to do, your role, the first one is just flag it with the parents. That's an awkward conversation, I know. And people are nodding their head like, yeah. Especially with some families, especially if it's an only child. Yeah.
What's the best way to go about it? Especially
I'll be like, I think your kid's got autism, and run. No, in all
I'm actually in this
process right now,
moment, and I have flagged lots of things, and
that's,
when she opens the conversation, I go, oh yeah, and I've known, and so I'm
Yeah.
giving her examples, but
Yeah.
at the moment, neither parent are willing or, and as I said, at the moment, it's
Yeah.
like I just want to say, please get him checked, but
Yeah.
you can't.
the key is flag, flag, flag. And then there's going to be a time when you just have to say, it's time to get done. And then from the family from there, they need to go see a GP, have a pediatric assessment, and go. All right.
Because I've already implemented all the things at home. We have schedules on how to leave the house and everything, and they still.
Sometimes it's just time to say it. You know, and it's going to be an uncomfortable conversation, but if that's the way it is, it just has to be said. I'm sorry, guys, I'm going to have to end there. But if you have any more questions, feel free to email, because I'm more than happy to respond by email. It might take me. Yeah, I have a specific one. It's just robbie.singh at autismpartnership.com.au. So yeah, if you guys have any of that, please shoot to an email. I'm happy to answer most of the time.